Greetings, everyone, and welcome to our February Historically Black Colleges and Universities Learning Collaborative. On behalf of leadership and staff at the Center to Champion Nursing in America, I thank you all for taking the time to join us for this important discussion. The Future of Nursing Campaign for Action is happy to bring today's webinar focused on fundraising for your health equity initiatives. Before we go any further, I do want to mention that we are recording today's webinar. If you missed a section or would like to pass it on to a colleague, which we highly encourage you to do, you can find the recording by going to www.campaignforaction.org/resources. I now have the honor of introducing today's speaker, Dr. Lisa Sundin. To save on time, I'm not going to read her full biography. It will be available on our website along with the recording of the webinar. Dr. Lisa Sundin is assistant professor at Fairfield University Egan School of Nursing and Health Studies and director of the Healthcare Administration Program. Dr. Sundin is a national consultant for us at the Center to Champion Nursing in America and a national leader on the Research Work Group for Nurses on Boards Coalition. So at this point, I'm happy to hand it over to Lisa. Lisa, please take it away.
Okay, well, thank you, Wynn. Thanks for that kind introduction, and welcome everybody to today's webinar, Fundraising for Your Health Equity Initiatives. It's a pleasure to be here with all of you. And Jasmine, if you could please advance the slide. All right, well, the time is long overdue to address health equity and social determinants of health. The Campaign for Action, the Robert Wood Johnson Foundation, and AARP are, as you know, keenly focused on these initiatives, as is the National Academy of Medicine through their recent report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. The campaign hosted a fundraising webinar on January 31st. You may have attended it, where we featured the value of using the NOM report while seeking funding. If you didn't get a chance to watch it live or you'd like to view it again, you can do so. You can find it by going to our website at www.campaignforaction.com. Today, we'll be following up with that webinar to provide you with more tools and ideas for your fundraising efforts with your mentoring programs and/or other efforts to retain and graduate your students. We need all hands on deck, and we are thrilled that you are so engaged with this very important work. The initiatives that you develop will make a difference in so many lives, so we need to make sure that you have the financial resources that are needed to operationalize your ideas. Now, today we will discuss the nuts and bolts of fundraising. And I know that is not the most fun topic for most people to think about. It's definitely not as fun as developing your ideas, but it is really important to understand the skills and be able to use them in order to fund your ideas and make them a reality. So, Jasmine, if you could flip the slide for me, please. Thank you. Well, before you can think about raising funds for your ideas, you need to get very, very clear about what it is you plan to do. After all, if you can't describe your initiative in clear terms that a potential funder can readily understand, it's unlikely that they'll feel confident in giving you the money that you're asking for. So step one, get clear about your initiative. Think about these questions, and you can see them right here on the slide. What is the initiative? What problem will be addressed or solved? Who will benefit? When? And how? To what extent? In what time frame? What are the costs involved in your proposal? And what value does the initiative offer? So as you think about these questions, put yourself in the shoes of a potential funder. Are you convincing yourself that this is a timely, relevant, and important project that will have value for the community? How can you realistically address the social determinants of health and health equity with your initiative? Think about the impact your initiative could have. Who can you partner with in your community to be successful? What is feasible to do? And how will you develop sustainable outcomes? How will you evaluate your outcomes? So many questions. And of course, how are your initiatives linked to the NOM Future of Nursing report recommendations? You really want to leverage those recommendations to support your proposals. So spend time with this step. The clearer you are, the easier it will be to describe and explain your ideas to a potential funder. And if you could change the slide, please. When you think about the value of your project, you are beginning to craft your case statement or a case for support. The case for support and the value of the project are closely linked. So spend time with this step as well. Again, leverage the data and recommendations from the NOM report to help guide you. Later, we'll discuss how to craft your case statement around funders' priorities. Next slide, please. Okay, you're clear about your project, its value to the community, and your case for support, which we'll talk about in just a little bit. Now you want to start looking for potential funders. I've given you a categorical list here of funder types from the broadest, in other words, like global funders, to the narrowest, or individual funders. I've also given you a few links at the bottom of the slide that you can search on your own with national directories for fundraisers. I want to spend the majority of our time today discussing state, local, and foundations and private funders. So much of the information that I will share can also be relevant for regional, national, and global funders, but generally for those funders, you will not have the same level of personal communication as you will with more local funders. In the cases of global or national or regional funders, your grant writing skills really need to be sharp, and that can be the case with local funders as well. Grant funding and sharpening your skills will help you to describe your project very clearly and to differentiate it from the many, many, many applications that are reviewed at that higher level. In terms of local and state funders, think about foundations, banks, local corporations. Even the larger national and international corporations can have local funding priorities in your area. So don't forget to check them out. And an example is that I'm thinking of are healthcare insurance companies. So I'm in Connecticut, and Hartford, as you know, at least at one time was the insurance capital of the world. And while they might have national or international funding priorities, they also have local funding priorities that you would want to know about for your ideas and your proposals. Next slide, please. So as you investigate potential funders, you want to have your case for support and your value for your project in hand. For each potential funder, be sure to do your due diligence. What are their current funding priorities? And I do mean current. Do these priorities match your project and interest? Do you have a good fit? Fortunately, many funders are focused on issues related to health equity and social determinants of health right now, but you still need to be sure your project fits into their wheelhouse. Time is precious and funding priorities can change. So you want to focus your time and energy on those potential funders who you have the best fit with now. If your project focuses on food security, for example, but the funder is focused on health literacy, it might be best to look elsewhere, at least for right now. Similarly, if the funder has priorities in children's health issues and your project focus is on older adult population, well, you might want to move on, at least for right now. Keep a list of all the funders you investigate and visit their websites frequently so you can see if their funding priorities have changed. Also, and this is very important, be willing to tweak or bend your project ideas to fit funding priorities of potential funders. I'm not saying to lie or to say things that are not true in any way, but if you can match your project with funding priorities, you have a better chance of being funded. So here's an example. If a funder is focused on children's health and your project focuses on food security in general, well, perhaps you can find a way to incorporate children's health into the idea of food security for your project to be more attractive to a potential funder. Here's another thought. Funding is often distributed in very regular cycles, so the timing should be part of your investigation also. Sometimes funders have discretionary funds and can offer funding off cycle. So to be able to know about this, it's really important and helpful if you know somebody within the funding body or organization who can tell you about discretionary funds. They're rarely advertised. So as is often the case, it pays to know people. Next slide, please. Okay, so this brings us to relationship building as a critical part of fundraising. In fact, some would say that fundraising is all about relationship building. Your time spent in cultivating relationships with funders is always worthwhile, whether it's for your current project or for your projects in the future. A few notes about relationship building. This is a process that should be continuous, not only when you need funds. You know, that's like, you know, only doing good deeds for your parents when you need money versus doing good deeds because it's important to do good deeds. That's the mom in me speaking. Relationships with funders should be bi-directional. Think about how you can help the funder. Maybe you give them information or introduce them to key people in the community. It's not just about them giving you their money. You need to be willing to give also. That's the idea of a bi-directional relationship. Next point. The relationship process is not about asking for money. We get to that later. The relationship building process is about cultivating a relationship. It's a long-term proposition that requires and deserves your time, energy, and respect. It's possible that you'll reap more from this approach than just asking for funding. For example, you might be introduced to other funders or supporters for your current or future projects through the relationship building process. Here's an example. In Connecticut, we invited an executive director of a funding foundation to be part of our board of directors because of her expertise and understanding about health policy and health equity in our state. Over time, we had applied for funding for an initiative that we wanted to push forward, but we were denied that funding. However, this executive director who we had invited to be on our board felt strongly about the work we were doing and had discretionary funds to support us. So she gave us $10,000. And that is the power of relationships. It wasn't about the funding. It was about developing a relationship that then led to the funding. And that's a very important distinction to make. Next slide, please. Okay, so given what I just shared about relationship building, who would you say is fundraising all about? Is it about you? Is it about your initiative? Or is it about the funder? Well, if you said it's about the funder, you're right. Ding, 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 you get a prize. As you continue to cultivate the relationship, keep in mind these two questions. Why should the funder invest in you? How will an investment in your initiative help them meet their mission? So if you notice, these two questions are not about you, and they're not even about your project. The funder needs to feel confident that you will be a good steward of their money and their mission. As you continue to develop the relationship, emphasize your common goals and concerns for health equity in the community. You're developing sort of a one team approach through this relationship building process. Here's a tip. Ask for advice, not funding, at least not yet. When you ask for advice, you're showing that you value the funder beyond their money and that you respect them. Maybe you can, in time, share with them how you took their advice and how it advanced or helped whatever it is you were trying to do. You're filling that relationship bank that way. By spending time building relationships, the ask for funding, when it finally comes, is a natural extension of the relationship. This is the power of relationships. It's not about the funding, right? It's about building the relationship and then making that ask a natural extension of it. Next slide, please. All right, so I talked about the case statement several times and I didn't forget about it. Let's get back to it now. Your case statement is the compelling reason why a donor or donors should invest in your organization or your proposal and establishes your core messages. The case statement should be compelling and inspiring. It articulates the purpose for your initiative or maybe even your whole organization, what you have to offer donors and how you will help them achieve their goals, why donors will be confident about investing in your initiative, and what specific outcomes and impact can be expected from your initiative. The case statement should be a foundational document for your initiative or your organization, one that can be tailored for different donors, yet maintains a consistent core message. This is a very good place to leverage the data and recommendations from the NOM report to support your ideas and your initiatives. Because of its foundational nature, you will want to spend a fair amount of time dedicated to developing and crafting the case statement. With a well-developed case statement, you can develop messaging that is tailored to different donors. The case statement can also be used to develop collateral, marketing, and communications materials, to develop grant proposals, and to solicit letters of support from your partners for presentations and even email messages, all that retain the consistent core messages of your initiative. Next slide, please. Thank you. So once you've developed your case statement, you'll want to start contacting donors and developing these critical relationships. First and foremost, always start by developing a personal contact with the donor organization. And that is so important. I want to say it again, and maybe you'll say it with me. Always start by developing a personal contact with the donor organization. Always find a warm introduction to a specific person by name before you submit a proposal for support. Always personalize, and hopefully you've already started that relationship. This is especially important when contacting local donors. Keep in mind, as you reach out and develop relationships with potential donors, use your core messages from your case statement, leverage that case statement, always focus on how you can help donors achieve their goals. Be sure to thank them if they've already given to you in the past, and tell them how their donation was used to serve others or to meet their funding priorities. If they haven't offered you a gift yet, thank them for their funding priorities. Be conversational and be ready to tell compelling stories. Stories are critically important. They bring your shared purpose to life. They convey the value of investing in your initiative, and they can create emotion which can often be the reason that funds are given. A story that is compelling to a donor is one that speaks to their funding priorities and shared community concerns. A well-developed donor relationship should end in an ask for support. It's the natural extension of the relationship. So finally, we're getting toward the end of this presentation, and I'm finally starting to talk about the ask. But you can see how much effort and time and activity comes before making that formal ask. But now that we're there, the reality is if you don't ask, you won't get funded. A rule for funding is there should be no mystification. Once you start that critical relationship building process, the idea that an ask will be a natural extension of it should be expected from both parties. They should be anticipating your ask as a natural extension of the relationship. And listen, you miss 100% of the shots you don't make. So make the ask, whether you do it in writing or in person, whichever is most appropriate and expected or required. If your relationship building has gone well, the funder should be waiting for the ask. After all, funders fund. When the timing is right, they will expect your ask. The link on the slide provides this information for you, along with several sample fundraising letters. And once you go into this link, notice how they leverage compelling stories to illustrate the value of their project proposals. Next slide, please. Okay, now what? Let's say that all your efforts were successful and you received all the funding you were hoping for. Good for you, that's great. It's time to celebrate and put those funds to work. But do you still have obligations to the funder? Well, be sure to read the fine print of your funding agreement. Typically, you'll need to provide some level of reporting about how the funds were spent and what your outcomes were. You may be required to return any unused funds. So be sure to read the fine print and keep impeccable records. And these are technical obligations that you might have. In terms of the funder, remember that you're in a long-term relationship. Be sure to offer gratitude to the funder whenever you can. You can do this directly, and if appropriate, do so publicly. Your communications with the funder and with the public need to explicitly acknowledge all funders related to your project, no matter the amount or type of funding. This is part of the continued cultivation of the relationship. Think about bringing your funder to your project site to see for their own eyes the funds at work, their funds at work to improve health equity. Now that's powerful. In short, even after you've received the funding and after you launch your project, you are responsible for stewarding the relationship with the funder. This isn't only important now, but also in the future if you plan to ask for more or additional funds. Also, funders know each other and they talk. So you want to be sure that you're the grantee they're sharing the best stories about. Okay, so that's all well and fine when you receive your funding. But what happens if you're denied funding? What if the answer is no? How can you manage the no? Well, in many ways, the principles already mentioned still apply. Show gratitude, communicate, continue to steward the relationship. Consider bringing the potential funder to the project site to see the work that's being done, even if they've denied you funding. If your ask or proposal is denied or declined, send the donor a message of sincere thanks. Then follow up in a month or two. Maybe you'll invite them for coffee so you can continue to develop the relationship and further understand the donor's priorities so that you're better positioned for your next proposal with them. Often no doesn't mean no forever. Often no means not right now. With the right strategy and investment in the relationship, you're best set up for a yes in the future. Next slide, please. So here are my fundraising takeaways for you. Get clear about your ideas and your initiatives. Know what value you bring. Develop your case statement. Understand the funder and their priorities right now and as they change. Cultivate those relationships. It's a long-term proposition. And remember, it's all about the funder. You want to develop a personal contact with all donor organizations, and don't forget to make the ask when the time is right. Then, when you get the funding, get the work done and continue to cultivate the relationships. Manage the no and make it a future yes. And of course, we want you to leverage the recommendations and reputation of the NOM report to support your funding proposal to improve health equity. And if you could switch the slide for me, please. I am happy to take questions at this point.
Okay, great. Thank you so much, Lisa. So at this point, we would love to hear your questions or comments. You can use the chat, or you can unmute your line and start the conversation. So I thought the points that Lisa made were really important. This one that I repeated in the chat about asking for advice. So there was a contractor, a fundraising contractor that we worked with the campaign for about 4 or 5 years with action coalitions. And a statement they repeated over and over is, when you want money, ask for advice. And when you want advice, ask for money. So start your relationships asking for advice. And it could be, I see your priorities are X, Y, or Z. What advice would you offer that my School of Nursing can help you achieve that goal? Yes, and there's a question, can you get a copy of the webinar? Absolutely, and we will also be sharing this on our website under Campaign for Action. So Jasmine will send it out to the distribution list for the HBCUs and the coalitions that are on this distribution list. And we will also be posting it to campaignforaction.org/resources. Other comments? Anyone, has anyone who has successfully written a proposal, obtained funding, other pieces of advice that you could offer?
Hi, everyone. This is Deborah Brabham.
Hi,
I
Deborah.
have written a proposal and received $1 million scholarship for a project we did here in Florida, Frisch Institute for senior adults. And we wrote the curriculum for nurses taking care of older adults. The donor had a great interest in helping the community to meet the needs of senior citizens, and they felt it necessary to start with the School of Nursing. So we wrote the proposal, we received the funding, and everything that she shared here. My comment would be was that it was impeccable that she mentioned all the key components that my college or my institution, the steps that we took to get that money. And then last but not least is writing that final letter of appreciation and then showing how we use the money and showing those outcomes was some of the things that we had to do. So it was just encouraging to see it in writing, to hear the presenter elaborate on those key points. And then if you don't get the money, don't use that as an opportunity to shut down, but use that as an opportunity to further inquire about how I may be able to seek funding in the future. So thank you so much for that presentation.
Oh, congratulations, Deborah. Great work. I mean,
Mhm.
you really just demonstrated how this process works very successfully.
Mhm.
And, you know, once you get a foot in the door with a funder, you're much more likely to be funded again. So good for you. And even if you're not funded by that funder again, as I said earlier, funders talk to each other. So maybe another funder, after hearing about what you did with the $1 million that you were so successful with, maybe another funder will say, hey, you know, we're confident in you. We want to give you money now too.
Mhm.
So great example, and congratulations on your great work.
Mhm.
Yeah.
Yeah, indeed.
Thank you.
Congratulations.
Yeah.
Yeah.
Welcome.
When this is Bernal, and thank you very much, Dr. Sundin, for that great presentation, and it really amplified the first webinar that the center hosted, and really kind of really drilled down much deeper. I wanted to make a comment, and then I wanted to ask a question. One of the things that I've learned over the years is that oftentimes, especially with HBCUs, there isn't the bandwidth needed to necessarily crank out those grant proposals. And faculty are very busy with, you know, their teaching responsibility and all the other things that go into academic nursing. Um, but at the same time, they often have great ideas about programs or projects that in my opinion are very fundable, very worthy. How and what kind of recommendation would you make to faculty, for deans and some of those kinds of schools, to help them begin to crystallize some of that thinking? And then how do they take that and move it forward so that it, you know, can become funding? Because if you get the funding, then you have more resources to do other things. But oftentimes it's getting that first funding going.
Right. Yeah, really good question. And I feel your pain. I'm in an academic role also. So, you know, it's hard to fit it all in. What I would say to you is first look within your university. Though your School of Nursing may not have the bandwidth to develop all that is needed to put a proposal together and a grant together, you may have other resources within your university who can help you do that. So I would say look within first, and then I would go back and say, try to create some partnered relationships within your community outside of the university who may be able to help you with your project. So now I'm kind of taking the Action Coalition approach to this. Who are other players within your community who have similar shared interests, who may have the bandwidth to help you pull a grant proposal together and really help you see it through if you do get the funding? And Wynn, I don't know if you have anything to add to that.
I do, Lisa. So in fact, so some of the schools that we work with here, the overall university or college also lacks the bandwidth to help the School of Nursing with their fundraising. And so oftentimes the faculty with whom we work are on their own when it comes to this. I love your idea of seeking the support from other entities in the community, including and especially action coalitions, because then it could serve schools more than just your own school. So for example, the Maryland, I think it was Coppin State, a faculty member at Coppin organized a statewide proposal to HRSA for a statewide mentoring program for not just the HBCUs in the school, but for all the schools of nursing. So they got all of the schools of nursing from Maryland involved in the one application. And that was another way to share resources, and it made the application stronger and more attractive to the federal government. And that was before all of this new infusion of funding for nursing education. And that's the second point I want to make. I've probably made it before, but there might be a couple of folks on today's webinar that haven't heard this, but HRSA has a historic amount of funding right now, especially for health equity for schools of nursing. And they need to spend it. If they don't spend it, that will get dinged. That funding will get dinged in the future. So it needs to be spent. HRSA is incentivized itself for you, schools of nursing, to apply for their funding. And so if anybody here needs information on how to find out more about HRSA funding, you can contact me. We also have featured the director of nursing and public health. We have several webinars from her over the last 2 years talking about how to apply for funding. Tara also announced recently that the regional HRSA's regional offices are putting together a plan to implement technical assistance to help you out in the world there apply for their funding. So they are putting in resources to help make sure that you apply for their funding. And another point that Tara has made, for us at least, is HBCUs and Hispanic schools of nursing and American Indian, Alaska Native Serving Schools of Nursing don't often apply for their funds. And so they want to fund you. They want to help fund you. So if there's anything, any other barriers between you needing funding and HRSA wanting to give you funding that you need help with, please contact me. And my email address is wquinn@aarp.org. I might put you, Lisa, I might put you in touch with them to maybe help them start their grant application. So correct, Deborah, HRSA does not make it easy to apply, which is why they are going to be providing these technical assistance programs in the regions. So great.
Information.
So Lisa, I am going to also offer your services when need be.
Happy to help where I can.
Okay, great.
Yeah, and it's so true. There's so much money. There's so much money to be had right now. Don't leave it on the table. Apply for it.
Yes, they are highly motivated. Please place your contact. Sure thing. Very highly motivated around diversity, equity, and inclusion right now. So they want you to apply, and we want to help you apply. We want to help you get funding,
Right.
whether it's from HRSA or local funders.
Mm-hmm.
Oh, there's another resource.
I think
Oh,
Tracy.
Somebody has their hand up?
Yeah, Tracy.
Okay. Hi, Tracy.
Yeah, hi. Good afternoon to everybody and to my colleagues. Thank you for mentioning the one about Coppin, and also Morgan was the lead, Dr. Anderson,
Right.
for the collaboration with that. And but I do also just recognize that my role as a dean, to put an infrastructure in place. Sometimes your university may not have a fully infrastructure. So what we did was we put some of the common components that are necessary for people to have in their documents, like their needs statements, trying to put some information related to like our data points. In the state of Maryland, what they did do, which I thought was very helpful, because we many times with the nursing support program, we're doing like an annual database. So that information with how many nurses you have, also how many faculty members you have, some of your demographic information, by that being present readily, that has helped some individuals to be able to pull from that particular area. We also have some individuals who have already have grants. And so we encourage them to work with other people, but you are correct. Maybe they have to go outside of your respective area to work with somebody else in another discipline, however, it can be complementary. In our state, I found out that there are a lot of interagency agreement funding opportunities. And so we were awarded some for flu and COVID, which was a natural pathway and aspect, but we also got some for trauma-informed care, aspects related to grieving, and for a medication assisted treatment for substance use and substance abuse. So we also work with our colleagues, which were in psychology and the area of social work, to make sure that that was more of a win-win, so that way ultimately we could definitely do it. We found with one of our collaborations with UMB, University of Maryland, Baltimore, is that we just agreed to be a sub. It was really, the scope of work was too much for us to do at that particular time, so we agreed to be a sub. But I think that there's a multitude of strategies. It's not like one size fits all. You have to kind of look at your institution. I do think that it is challenging, even more so now because of COVID, because people's energies may be more focused on wellness. But yet and still, I do agree that if there is ways that we can do that, I don't think that HRSA has made it very easy also, they've indicated. And then sometimes people just may not have the extra time to, with the logic models or whatever else is asked about. So those templates that I mentioned, by having it on our platform, people at least have a place to start with. And our college is a college of health professions, health information management, health sciences. I've also found that by collaborating with the individuals in health sciences, health information management, that has helped significantly, because they may have more information related to data science, and also some things related to things that could help you to strengthen your application overall, and connect the dots. Go back and make sure you have enough time to make sure that your objectives match up with your plan, match up with your evaluation plan, your management plan, your resources, that all those dots are connected. You have to have somebody who has keen eyes that will connect the dots. And maybe you will work with your English department to help you with something like that. So there are many ways to actually collaborate with others and then put them into your grant. And there's ways they can do that also. And I think that you can find win-wins in your university.
Wow, Tracy, that was fantastic. Such great information. I love the idea of connecting the dots. That's one of the things that maybe you do, or maybe you don't do, but if you do it, sometimes you don't think about it, but you made it very, very clear. And that is so important. Everything needs to be congruent and aligned and connected when you're putting together a proposal. Also, the idea of having some established or developing infrastructure in terms of boilerplate language can be really helpful to moving forward a proposal where you don't feel like you always have to start from ground zero, right? You know that there's a fair amount of common language that's often asked for in most grant proposals that you can literally copy and paste in, and maybe tweak a few words here and there. But you might find that already pushes you 25% down the road, and isn't that helpful? And that's kind of enduring information that is there for anybody in your university or your school to use. So thank you for that really helpful information.
Indeed. Thank you so much, Dr. Mary.
Can I add one thing I forgot about? We have a business manager, but what I find out is that people may not understand. So I help with the business, their budget component. And I think that's the strength that the dean could provide sometimes, because we do it a lot more. Our budget and budget management, budget narrative, but also to look at it, to connect those pieces. And I think that maybe that's something that when you talk about those technical assistants, that could be a benefit to individuals, because they don't always know like how to quantify the ask and to put it over 4 years or 5 years, or however much it is, and to make sure that it is appropriate, and also that it is actually fundable, like it was in the proposal, the request, that it was there, and to make sure they put in the percentages for their whatever their particular university uses for the in-kind dollars and those components. And maybe in-kind isn't allowable. So just that would help, I think, for individuals to clarify and understand how the budget is critical to those dots. And if you don't do that correctly, you also possibly won't get funded.
Another really good point. Now, usually when you're working with local donors, the proposal process is not quite that onerous. In fact, sometimes it can be very informal, but certainly with your national funders, all of your points are extremely well taken. and just highlights the importance of connecting the dots, as you say. Yeah, and having those sharp grant writing skills.
So Karen Rawls has made a couple of suggestions in the chat. She says that the Writing Center on your college or campus is a great resource. And then Karen, can you say more about research and review of a similar proposal can provide a great template? Or are you thinking that when you see, okay, go ahead. If you could speak up, that would be great.
Hi, everyone. It's great to be here with you today. I have missed so many of these meetings, and I'm just so glad that I was able to spend some time with you today. Actually, I worked in the education department for Grady Hospital here in Atlanta, Georgia. And we have had many opportunities to write grants in that department. Little known thing about Grady Hospital is the education department consisted of 30 nurses, and of the 30 nurses, 75% of us had doctoral degrees.
Great.
And so we did a lot of the grant writing, we did a lot of the proposals, we wrote a lot of curriculum, all those types of things. And one thing that we found and that we really stood by is once we wrote one proposal for one particular topic, we would go back and use that same template.
Yeah.
And we would also research and see what other proposals had been written on that topic so that we could expand our bandwidth in terms of what we were asking for and also in terms of the specificity of what we were asking. And so your resources, if you just Google some of the proposals, just like, for instance, if you want to ask, if your ask is for equipment, that you need additional simulation equipment, or that you want to have a program that you want, or a conference that you want to put on that is going to focus on something like Talk to Me Baby, or anything that is real specific is a good opportunity for you to take it and put it into Google and just Google it and see what's out there in terms of who's written a proposal, how the proposal was put together, and also how much money they received in terms of that grant. Like I said, at Grady, we do that. We have done that many, many times and have gotten millions of dollars to be able to do the work that we have done there at Grady. But in addition to that, at other schools, because I also sit in faculty at other schools, and we do that as well. And the Writing Center is a great place. Too many people don't take advantage of that Writing Center, but those are your subject matter experts in terms of making sure that your information is correctly written, which is very, very important, because if you send in a proposal and the grammar is inaccurate, or the language is not there, or the numbers don't add up, you're kind of shooting yourself in the foot. And so that's what I was bringing out with the comments that I was making. And thank you for the opportunity.
Absolutely. Thank you so much for sharing your knowledge and wisdom there.
Mm-hmm. Yeah, thank you, Dr. Rawls. That's very, very helpful. When you talk about using previous research proposals as a template, I think of that as sort of a formula, right, that others can use. And that's the beauty of having templates. When you're looking at larger funders, larger funding organizations, oftentimes when you see that call for proposal come out, they will have previous proposals that were funded there too. So you can take a look at them and see how those were written, knowing that they were funded. And that again is a type of template or formula that you can use to develop your proposal. Thanks for your insights, really helpful.
Any other questions or comments? We are getting toward the top of the hour. Okay, I think we can wrap up. Lisa Sundin, thank you so much for sharing your wisdom and knowledge here with everyone. I've been messaging privately back and forth with somebody. I think we will be calling on your services to work with a set of schools from the state. So I'll let you know about that. Again, for folks out there, if you want more help as far as resources are concerned for fundraising, please reach out to me, wquinn@aarp.org. I put it in the chat. I'm also on the distribution list that gets sent out. And I also put in a link. There's an organization, a national organization called United Philanthropy Forum, the United Philanthropy Forum, and I provided their link. They have a list of all of the funders in your state, the private foundations. So if you might want to take a look at that to see if there are philanthropic organizations in your state that you had not yet initiated contact with. You might want to start creating a relationship and asking for advice after you see what their priorities are. So, so with that, I do want to remind you this webinar will be posted. Jasmine will do a little bit of her magic in getting it in tip-top shape for sharing, and it will be on our website, www.campaignforaction.org/resources. And Lisa Sundin, thank you so much for all of your help. Any parting words from you?
Thank you. No, it's been a pleasure talking with all of you. And, you know, listening to those of you who spoke up, you know what to do, right? So you know this stuff. And sometimes we want to, I said this early on, we want to shy away from the fundraising because it's just not the fun part of things. But once you break it down into, you know, small actions, you realize it's people talking to people. And we all are looking for a common good. And that's you know, that's kind of the mindset that you want to go into it with. And I wish you all the best in developing your proposals and getting funding and making a difference in your communities. Thanks so much for the opportunity to be here today.
Great, thank you, Lisa. And on behalf of AARP's 38 million members, thank you to all of you for all that you do for patients and their families. Thank you so much. So with that, it's a wrap. We'll see you next month.